For the first time in 15 years, the American Academy of Pediatrics releases guidelines about treating children with obesity. Now on your side, Sarah Gray-Barr joins us in the studio with more details on these guidelines. So Sarah Gray, what are they suggesting?
Ken, doctors with ECU's Brody School of Medicine says that these guidelines are the first of their kind because they're evidence-based. And before that, the American Academy of Pediatrics recommendations were opinion-based. I spoke with health experts about what these guidelines mean to Eastern North Carolina.
So we now have evidence-based guidelines telling us how to assess, manage, treat patients, pediatric patients that are overweight and obese.
Collier says it's common among children.
In Eastern North Carolina in particular, we have a very high prevalence of children who are overweight or obese, but of particular concern, we have a very high prevalence of children who are extremely obese. Nationally, about 4% of children meet that criteria, and in Eastern North Carolina, 10 or 11% meet that criteria.
The new guidelines include 13 key action statements.
These address who we should be screening for obesity and weight status, how to do that, how to assess it, and then what we should offer those kids with those problems.
When it comes to treatment, some recommendations are
we should use intensive lifestyle intervention as the #1 tool, engaging family members, using motivational interviewing, setting patient-centered goals, working with families, communities to address the issue.
Others are encouraging a more proactive approach.
So the American Academy of Pediatrics is recommending that we offer surgical weight loss for children at ages 13 and older who meet certain weight criteria and have weight-related health complications.
While the guideline does not discuss obesity prevention, Collier says
many of the things that are important for treatment are also important for prevention. So certainly good physical activity, good sleep, good food, appropriate caloric balance, all of those things that we would use to help treat obesity also will be important for the prevention of obesity as well.
Nutritionists with Craven County Schools agree.
By offering more whole grains, by having students pick up a low-fat dairy, by eating more lean protein, that gives the kids that advantage that throughout their lives that they have been making these decisions, and then that stays with them.
Collier also told me that these guidelines really just formalize what many doctors already know, and that treating children sooner rather than later can prevent weight-related health issues as they grow into adults. In studio, Sarah Gray-Barr, 9 on your side.